Good day, everyone. Welcome to the webinar COVID-19 Relief Package and its impact on behavioral health. As I'm sure you know, online access is being used more than ever during this time, and so the quality of the presentation may be more strained at times than usual. If you're experiencing sound or technical issues, please comment in the chat room and I will address it after I'm done talking. My name is Angie Fiedler Sutton, and I'm with the Behavioral Health Association of Providers. The Behavioral Health Association Providers, otherwise known as BHAP, is a national trade membership association that provides education and advocacy for behavioral health care providers and related entities. Formerly known as the American Addiction Treatment Association, BHAP is the leading and unifying force of addiction-focused treatment programs. We provide membership opportunities such as networking and various benefits, educational opportunities such as this webinar and our Certificate in Addiction Treatment Marketing, CATM, and advocacy efforts to keep those in the industry aware of new laws and regulations that may be coming that will affect them. But a membership in BHAP gives you something everyone finds valuable: time. Working in the behavioral health industry or managing an organization in the industry can be incredibly complex and filled with ever-changing information for compliance. BHAP gives you resources to stay on top of the rules and regulations for your organization to stay compliant. For more information about BHAP, you can visit our website at www.bhap.us. Before we begin this webinar, a few housekeeping details for those of you joining us for the first time. You will be able to hear us, but we won't be able to hear you. That's because we record these webinars so you have access to them later if you need them. However, if you have questions or concerns, you can use the chat room on the lower left. You don't need to wait until the end for questions. We will be sending a link to the webinar and the PDF of the slides via email after the event. And now, it's my pleasure to introduce our presenter today. Andrew Kessler, JD, is a founder and principal of Slingshot Solutions, LLC, a consulting firm that specializes in behavioral health policy. With 20 years of policy experience and over a decade in behavioral health, Andrew is a fixture in circles that advocate for substance abuse treatment, prevention, and research. He collaborates frequently with congressional offices, the White House Office of National Drug Control Policy, the National Institute on Drug Abuse, NIDA, the Substance Abuse and Mental Health Services Administration, SAMHSA, and other federal actors. Andrew has written legislation and report language adopted by both the House and Senate Appropriations Committee and has presented orally before such bodies as the Scientific Management Review Board, the National Conference on Addictive Disorders, and the College on Problem of Drug Dependence. He's also BHAP's advocate in Washington, D.C. If you are a BHAP member, one of your benefits is access to a monthly call with him to hear about and ask questions about upcoming legislations that may impact the behavioral health industry. Andrew, thank you for taking the time today. With that, I will present the webinar over to you.
Thanks, Angie, and good morning to everyone on the West Coast. Good afternoon if you're a little further east, as I am, and happy to be with you here today. For those of you who have been on my webinars in the past, this one's a little different, very specific, and we're also flying blind a little bit. We're in a new world order, both inside and outside DC. We're going to try and break it down as good as we can for you. In advance, I will have to apologize if you hear any background noise from my end. I, like many, am now working from home with a full house of a spouse also working from home and 2 kids schooling from home. So apologies in advance. We can skip through the introductions as Angie gave that already. There you have my experience, but time is short today. I've only blocked off about a half hour to do this because this, like I said, we don't have a lot of depth to deal with. We've been trying to get things kind of out the door and to the States, and it's happened really fast, and there's not a lot of meat on the bones, but let's explore what's out there. There's obviously a lot of regulatory challenges that we're going to have to deal with in this new world order, like like telehealth, new Medicare guidance. There's been some regulatory changes about how Medicare patients can now access telehealth during the duration of the emergency, as you see laid out here. This is one of the first things that the government addressed. New coding for the assessment for psychology assessments via telehealth, but not for psychotherapy. New codes available for licensed clinical social workers and psychologists to bill Medicare for telehealth. and now telehealth can be done over the phone for the duration of this public health emergency. You don't need a video connection. So those were some of the first changes that were made. Um, Now, in addition to these regulatory changes that were made, there a lot of you may work in areas that don't necessarily have the resources you need to provide the best telehealth possible. The FCC, the Federal Communications Commission, is going to make $200 million available for the purchasing of telehealth equipment. Um, the program would support healthcare providers responding to the pandemic by providing eligible healthcare providers support to purchase telecom services, information services, devices to enable the provision of telehealth services during this emergency period. Now, what's not clear is if this is limited to the treatment of COVID-19 or if this money is going to be available to everybody. Because as many of you know, several of us in public health have are experiencing a downward trend in people actually utilizing our facilities and our clinical services physically. So all of us in public health across the board are going to need greater access to telehealth. So we're going to hopefully get some clarification from the FCC on who exactly is eligible for this grant program. And of course, as soon as we find out and there's more guidance, we're going to get that information to BHAP and we'll get it out to our membership. So just closing out the this discussion on the FCC, it's going to be a variety of services that can be utilized with this money. Teaching hospitals and medical schools, as you can see there, community health centers, some of you may work with, health centers providing health care to migrants, obviously a very big issue in California, local health departments that some of you may work in. Again, so it's a wide range of facilities that will be eligible. The question is, does it have to be directed at the treatment of COVID-19 or can it be used for other healthcare services? So we hopefully we'll be getting more guidance on that. So a lot of you have been hearing about this latest legislation that's come out of Washington, which we're calling Phase 3. I'm a big believer in giving you some background and a foundation to build on. So I'm not just going to jump right to Phase 3. I'm just going to real quick tell you about Phases 1 and 2 because my model for advocacy has always been you don't know where you're going until you know where you've been. So Phase 1, this was the first bill passed last month. And it was a $8.3 billion package aimed strictly at COVID for treatment and prevention. So we're talking about vaccines and testing kits. We're talking about health departments needing staffing strictly for the treatment and prevention of COVID-19, nothing else. And that was $8.3 billion. That was Phase 1. Then we got to Phase 2, I think about 2 weeks later. And this legislation focused on targeted relief for individuals and businesses, as well as more expansion for COVID-19 testing, 2 weeks of sick leave for employees who must self-quarantine, employer tax credit for said sick leave, family and medical leave, guaranteed coverage of testing. So we were still in the let's address the COVID-19 virus itself with this legislation. So the first two pieces of legislation were aimed strictly at trying to address shortages in the COVID area. Then we get to Phase 3. Okay. This is where we are now. This is the giant bill that passed last week that you've heard a lot about. This went far beyond COVID treatment. This addressed what I guess you can call the domino effect. the businesses, the healthcare workers, the healthcare structure, students, schools, everything. Because obviously our entire society has had to make adjustments, and a lot of segments of both the economy and society have been hit very hard. So this was the first major stimulus aimed at everybody, or at least, if not everybody, a very wide swath of the population outside of people specifically infected with the COVID-19. All right, so the bill appropriated $2.2 trillion. That's trillion with a T. Even for someone in Washington who usually deals in the billions, this is uncharted territory. To give you an idea of how much money this is, the 0.2 in the 2.2 trillion is 200 billion. So the 0.2 is twice what we normally spend on health and human services in a year. We usually spend about the budget for HHS in a single year in the United States is about $100 billion. The 0.2, so 10%, is twice that. It is incalculable. I was actually really good at math in high school and still am, and it boggles the mind. We're talking about 12 zeros. It's just nothing we've ever seen before. But we're going to try and break it down. We're going to start with the easy stuff. And the easy stuff is, first of all, $425 million was appropriated to SAMHSA. That's the Substance Abuse Mental Health Services Administration. $425 million, it's about 9% of their annual budget. Okay, sounds good. I want to point out that when I first read through the first draft of the bill and I saw this was going to be the amount to SAMHSA, at first I was excited. I said, wow, as an advocate, you see 425 million, you get excited. Then I read the bill a little closer and I saw what other areas of healthcare we're getting, and my excitement kind of faded. 425 million to SAMHSA isn't going to begin to cover what we're going to need as a result of the losses we suffer because of populations not being able to utilize our services in behavioral health. So we're going to get to that. Let's look at that 425 million. You'll see in that second to last line, this legislation is not very strong in terms of guardrails. What we mean by guardrails is strict guidance on how the money will be spent. This money had to get out the door fast. And as a result, there's not a lot of guidance. So let's look. 80% of this $2.2 trillion will go to state and local governments. Okay? Right off, in whatever form these grants or loans or whatever they take, 80%, that's about 1.72 trillion, is going to end up in the hands of state governments. So you're going to have to keep an eye on Sacramento or wherever the state you live in, wherever their state capital is. Most of you are in California. My work usually ends outside the Beltway. My job is to make sure that the money gets out the door. The money's getting out the door. When it gets to Sacramento, I coordinate with the people who I work with in Sacramento, and they'll be responsible for getting you information on these loans and grant programs that are available. But you're going to have to keep an eye on that. This money, for the most part, will go to your state capital, health agencies, and will be distributed from there. Okay, so the simplest part of the $425 million is $50 million for suicide prevention programs and $15 million for Native American tribal health programs. Now you have a large population of Native Americans in the West, and unfortunately, I wish I could tell you more, but that's all we know. The legislative language is literally that. $50 million will go to suicide prevention efforts. $15 million will go to Native American tribal health efforts. That's it. Usually when you're doling out that kind of money, we have either more specific language in the bill. We have something called a report, where the report accompanies the bill and says, this is what we expect it to be spent on. Nothing. We have none of that. The money is just going out the door. So when the states apply for it, it's going to be up to them to determine, to say to SAMHSA, this is how we plan to spend it. Whether that $50 million is on hotlines or outreach, whether that 15 million is on hiring more staff, nobody knows. The states are going to play a very large part in that. So that is as simple as it gets. Now we're going to get into some really complex parts of the legislation as it pertains to the money going to SAMHSA. $100 million will go to the states for state emergency response grants. These are grants that pop up every once in a while when there's an emergency. We have them for the hurricanes out east, Superstorm Sandy, Katrina, Harvey. Those storms, we saw state emergency response grants. I think after 9/11, we saw some state emergency response grants. It will be up to the state to apply for these grants and determine in their application what they want it spent on. These will then be reviewed by SAMHSA. The money will go out to the state, and the state will determine how it's spent. It could end up in the hands of providers, could end up in the hands of local and community healthcare departments, up to the state. So 100 million goes to the states. California should receive a large share of that, as they are the most populous state in the country, and they were one of the states hardest hit by the coronavirus. Usually these state emergency response grants have a regional tilt. States that are hit the hardest, Washington, New York, now we're seeing Michigan, Louisiana, tend to get a little more. However, there's no guarantees. Usually there's a formula that takes into account the state's population plus the size of the problem it's dealing with. So a state like, Nevada, that necessarily hasn't been hard and is low population, may not, will almost certainly not see as much. State like California, larger population, will see more. It's not 2 million a state by any stretch. It's up to the state to apply, and then SAMHSA will deem how much is to be received. All right, now we're going to get to the most important part of the SAMHSA budget appropriation from this bill. $250 million will be put into the Certified Community Behavioral Health Clinic Expansion Grant Program at SAMHSA. Okay? Now, this caused a lot of confusion amongst the policy wonks in Washington, and I want to make sure that everyone outside Washington is less confused. That's tricky sometimes because I speak in a language some of you don't understand, and I speak in acronyms. When I say CCBHC, that means Certified Community Behavioral Health Clinic. Okay? These were the behavioral health clinics that were established about 6 or 7 years ago by an amendment to the Public Health Act, Section 223. And 8 states were picked for a 5-year pilot project to have Medicaid reimburse these community behavioral health clinics. California is not one of those states. Okay? However, Congress has been trying for many years to expand this program nationwide. And last year, they succeeded in the sense that not all 50 states have programs that are eligible for Medicaid reimbursement, but if you are a certified community behavioral health clinic, if you meet the criteria of a certified community behavioral health clinic, you can now apply for funding from this grant. Okay, so I'm just laying out the definition of what a CCBHC is. Okay, so the $250 million is in the CCBHC account. However, it is not limited to the 8 states in the pilot program. When we first read this, many of us thought that only the 8 states in the CCBHC Medicaid Expansion Pilot Program would be eligible for this money. That is not the case. The CCBHC account at SAMHSA will house this money. Okay, now, who will be eligible to apply for this money? Okay, it remains to be seen, and SAMHSA will make the final decision. The question is, do you have to qualify for the definition of a CCBHC, and I'll get to that in a minute, in order to apply for this grant funding? We don't know. Can you be any kind of treatment facility? We don't know. Do you have to be a nonprofit because CCBHCs are required to be nonprofits? We don't know. SAMHSA will set the guidelines. We hope very soon. This money was meant to get out the door fast. It's already Wednesday this week. We're not sure if we'll see them this week. If we don't see them next week, I'll be very, very, very disappointed. Because what are we doing here if we can't get this money out to the states? Keep in mind, if this is grant money, once the grant's announced, we have to give entities time to apply. Then we have to give it time to be renewed. We have to give it time for the money to get out the door. So it's a long process as it is. Even at light speed, it will be easily 6 weeks before any of this money gets out the door. But we're dealing with a pandemic that's spreading way too fast. So not exactly sure how this is going to work. The difference between this money and the $100 million I mentioned before is that this will be available for application directly by facilities. The $100 million, it's the state that applies. This $250 million, it's the facility that applies. So once we know what kind of facilities are eligible, then we will know who can apply. If it is limited to facilities that would only qualify as a CCBHC, here is your guidance laid out for you. A CCBHC must provide the following: crisis mental health service, screening, assessment, and diagnosis, patient-centered treatment and planning, outpatient mental health and substance use services, and must be able to refer to primary care screening, targeted case management, psychiatric rehabilitation, peer support, counseling and family support, and veteran support. So I don't know if you have to check every single box, but you have to come pretty close. Again, this money was parked in this account because we wanted it to get out to the treatment providers as fast as possible. We will see which treatment providers are eligible. If you ask me, with the size of this problem in the United States, with the size of the challenge we're going to be facing brought on by COVID-19, this isn't nearly enough. As I said early on, when I saw $425 million, I was excited. I read closer and closer, and I'm actually more disappointed. So we're going to see how this pans out. Okay. So I got notification from a Senate office yesterday that SAMHSA had issued its first COVID grant. And it was sent to me, and I sent it out to BHAP leadership. I sent it out to other providers around the country. And they said, this is our first COVID grant. And what I saw was actually it's a grant on workforce, which is great. It's a grant that will allow organizations to apply and spend money on educating people who are in recovery and giving them job and vocational training, which is great. You're going to ask yourself, how is that a COVID grant? I'm going to explain it to you. And I'm going to give you one guess before I do. There's a famous Pink Floyd song about it, and it's one word, and it begins with an M, and it's money. This was a grant that was supposed to go out much later in the fiscal year. However, because SAMHSA just received an influx of $425 million on an emergency level, they got this grant right out the door. So a little bit of this politics. They get to say, look, it's our first COVID grant. Does it have to do with response to COVID directly? No, but it does have to do with the stress our system is under. I've been talking to a lot of people outside of Washington who have their boots on the ground, and they're saying the workforce is ridiculously strained because of not only the self-quarantines that are in place and the stay-at-home orders that are in place, but a few months from now, after everyone's been in isolation for a long time, after people have not had a lot of social contact for a long time, I can't imagine we don't see a spike in behavioral health disorders around the country. This is not a situation that is conducive to good behavioral health hygiene. It's just not. And our workforce is going to be just as slammed in 3 to 6 months as the hospitals and emergency rooms are now. I am anticipating relapses at a frightening rate as a result of what we are seeing. So our workforce is going to be strained. So any kind of legislation and money that benefits our workforce, I'm all for it. So this is just kind of a word of warning. Not all COVID money is going to be spent directly on COVID. That's kind of why we're here. That's kind of why we're at this webinar. What's the indirect impact going to be? How can we prepare for it? What remedies will there be? That's what we're all, that's why we're all here this morning. Let's move beyond SAMHSA. There's been a lot of questions about the small business loans that are available. Break it down right from the top. $377 billion will be available in loans to small businesses. That's less than 500 employees. I don't know where that number came from. That's an SBA number. Personally, I'm a one-man operation. I thought 100 was a big company, but less than 500 employees, you qualify for an SBA loan. Nonprofits will qualify, as will private businesses. This is important. In the original legislation, as it was written by the Senate, nonprofits that received Medicaid reimbursement for services were originally excluded from these loans. We worked, several of us in Washington, worked together with organizations you may have heard of, the National Council for Behavioral Health, National Association of State Alcohol Drug Directors, American Society of Addiction Medicine, Treatment Communities of America. We all banded together and we said, this ain't going to fly. And we actually banded with other health organizations outside behavioral health because this was going to impact way too many of us. It was removed. Usually, as an advocate, when legislation is finished and I'm doing this kind of presentation, I don't tell everybody what wasn't in it because that's just not productive anymore. But it's important to cite that because this was too important not to be included in. And the work of BHAP and other nonprofit associations that really need to benefit from this legislation was very, very important. I want to be clear. This is not $377 billion available for healthcare businesses or nonprofits. This is for all small businesses. If you choose to apply, you will be competing with retail. You will be competing with restaurants. You will be competing with the service industry. Anyone less than 500 employees. I'm not a business major. I am not an expert in economics. I know a little bit. $377 billion to keep small businesses afloat, not nearly enough. This is going to be a very, very cutthroat situation. Now, the SBA loans that if you qualify to apply for can be used for four things: payroll protection, economic injury or disaster, SBA Debt Relief, and SBA Express Bridge Loans. Those last two I included, but unless you have a current SBA loan or are currently working with a current SBA account, don't apply to you. It's really the first two that you're more interested in. I included them because you never know. It's really those first two. I see them coming up on 10:30 West Coast time. Originally, I thought I'd be done by now. I have a couple more slides. Bear with me, and I want to throw it open for questions. So I'm going to go through this last two parts of SBA, and I'm going to open it up. First part is payroll protection. Obviously, a very big deal. I know that many of you who work with as healthcare providers rely on Medicaid, and people aren't coming in. As a result, you can't bill. If you can't bill, you can't meet payroll. So go the dominoes. Under this program, eligible recipients may qualify for a loan of up to $10 million, okay, determined by 8 weeks of prior average payroll, plus an additional 25% of that amount. Loan payments will be deferred for 6 months. If you maintain your workforce, SBA will forgive the portion of the loan proceeds that are used to cover the first 8 weeks. Okay, that's as much as I know. So I'm going to get a little further into the SBA part. The second part, having to do with economic injury and disaster. Small business owners in all U.S. states, Washington, D.C.s, and territories are eligible to apply for an economic injury disaster loan advance of up to $10,000. That advance will probably, if I'm reading it right, be forgiven. Okay? The economic injury disaster loan provide small businesses with working capital loans of up to $2 million that can provide economic support to small businesses to compensate for the loss of revenue. Okay, the advance, the $10,000, will provide economic relief to businesses that are currently experiencing a temporary loss of revenue, and then funds will be made available within 3 days of an application, if you are approved. Okay, the loan advance, the $10,000, will not have to be repaid. The rest of the loan will probably have to be repaid, but I think it's a zero or a negligibly low rate. Again, I'm not an economics expert, and I have to give you a word of warning. I'm delving into an area of policy that is not my expertise. The best I can do is give you the basics. I'm becoming an expert quite quickly, but I'm just going to give you the basics. And the SBA Debt Relief, if you're currently under an SBA, if you currently have an SBA loan, this is a relief program that says the SBA will pay the principal interest of 7A loans, which is a type of loan. And if you have an express bridge loan from the SBA, this will allow small businesses that already have that have access up to $25,000. For the very small population of you that already may fit in that category, that's good. This is a link to the SBA page. This is probably the most important link I can put up there. I can't put up a link to the SAMHSA programs because they don't exist yet. Okay? I can't put up a link to the FCC programs on telehealth because it doesn't exist yet. This SBA link exists. So if you're watching this, if you want to take a screenshot, if you want to cut and paste, do what you got to do. I will leave this page up for the next 30 seconds or so, and you can cut and paste that loan, that link, so you have access to that. Angie will also include it in her email that follows up to this, and this webinar is also being recorded. So if you had to miss part of it or need to go back and rewatch to get the information you need, right here, sba.gov. The information is right there for you. Okay. So there's one other program, and that's the U.S. Department of Labor. Again, not my expertise, but we are aware of an availability of up to $100 million for dislocated worker grants to help address the workforce-related impacts. Again, if you're suffering workforce shortages as a result of this, this is the program you want. The qualifications are right there. They will provide eligible participants with disaster relief and employment training activities. These participants can include dislocated workers or those who were laid off as a result of the disaster. If your patient flow has suffered as a result of this and you can't get reimbursed and you're having trouble keeping the lights on and you need to unfortunately go to layoffs, this can hopefully offer some relief. If you're self-employed, a solo practitioner, or you own your own business, or if you are unemployed or underemployed as a result of this disaster, this is the program. Unfortunately, I don't have a link yet, but we'll be getting that to BHAP and it will be distributed in a follow-up email. Okay. And the last slide is phase 4 coming soon. We went through phases 1 through 3. I'll say this. Speaker Pelosi definitely wants a phase 4. She's already putting it together, as are Democrats on the Hill. President Trump has indicated that he is supportive. What the priorities are anyone's guess. Some of the big ticket items have been, more relief, expanded relief, so on and so forth. Hospitals that were possibly private hospitals that were left out of phase 3, larger corporations that were left out of phase 3. Who knows? As important as behavioral health is to all of us, and we know how important it is to society, unfortunately, it's not on anyone's top priority list when it comes to this kind of program. And it should be, because I'm walking around or calling around Washington saying, wait a minute, I seem to recall not too long ago, another public health emergency was declared called the opioid epidemic. So one public health emergency doesn't go away simply because another one comes along. Further, the second public health emergency can easily exacerbate the first. So we're a little frustrated by the fact that we haven't been at the top of anyone's priority list, but we're going to be working on that in phase 4. Several of us will be working together to get a list of our priorities to the speaker and to the leadership in the House and Senate, and see we'll see where we stand coming out of next week when it's being drafted. So I will conclude, and I know that some of you have questions. Angie is going to moderate the questions at this point, so I'm going to toss it back to her. Angie, if there are any questions, I will try to answer them, but like the rest of you, whether we're working in public health, whether we're working in law and finance, whether we're working in policy, we're all drinking from a fire hose here, and we're all, have our unique challenges to face. So I'll try to answer to the best of my ability.
Dave Sheridan has a question of any information on a FEMA program that
Yes,
seems to have been
Dave.
announced.
That's a broad question, because a lot of this money that I'm talking about, the relief money, quote unquote, is going to go to FEMA for emergency relief. A lot of the FEMA money is front lines, and that is, hospital treatment testing, ICUs, mobile hospitals, what have you. My question for FEMA and for Congress is, okay, what if someone comes in for presenting with COVID, but they also happen to be in need of behavioral health services? By law, especially if they're a Medicaid patient, if they come to an emergency room, you have to treat them. So you can't just, if you're in withdrawal, or if you are, have a mental health disorder, if you require detox, what's going to happen? Just as if you were in an ICU with COVID and you had a stroke, they've got to treat the stroke. Well, the same goes for behavioral health. So we're looking for clarification on that FEMA program, and we will get it to you when we can. But most of the FEMA money is going towards like field hospitals, so on and so forth. The question is, how expansive will the services of those field hospitals be? Ideally, they will only address coronavirus. In reality, we know that's simply not going to happen.
Okay, and then Walter Boone wants to know, when do you expect clarification on the SAMHSA grants, and what will they be for?
If I don't have them by next week, I would be, I won't say shocked, but I'd be disappointed. End of this week is optimistic. I don't want to say highly optimistic, but end of this week is somewhat optimistic. Early to mid next week is my hope. Many of us are working with SAMHSA to try and make sure this is framed the right way. So I can't make any promises, but if the point of all this is to get the money out the door fast, I would hope by the middle of next week. Do not hold me to that.
Okay. While we wait to see if there's any other questions, speaking of Walter, we are keeping a list of resources related to COVID-19 and behavioral health on the BHAP website, including a webinar we did with Walter and some other people from Balch and Bingham about the impact of the pandemic on behavioral health. That is available for free. So just go to our website, www.bhap.us, and you can find that information out. I'll also include a link in the thank you. While we are waiting to see if anyone has any questions, I will thank Andrew Kessler for presenting today. Thanks as well for everyone in our audience for participating. Like I said, I'll be sending a link to the webinar, and the PDF of the slides will be sent out via email in the next few days from an email ending in bhap.us. Be sure to keep an eye out for it. It does sometimes wind up in spam. If you are a BHAP member, you do get access to a monthly call with Andrew, so you can ask any questions. I'm sure that this month's call will involve a lot of COVID-19 related information, if I'm not mistaken. Any other questions? Okay. Well, we hope that you join us for future BHAP webinars. You can sign up for our various newsletters, which include emails specific to upcoming events at our website, www.bhap.us. If there are no further questions, this concludes today's webinar. Thanks again.